Recording. Okay. So this afternoon, we are indeed uh, very well motivated because we will continue our discussion. And I know that the level of energy that you manifested that last time is sufficient enough and acceptable enough for us to invite and imbibe ourselves to be ready with the next topic that we will continue to discuss. Now, as we always start with our discussion, let us embrace ourselves with the guidance of our Lord so that to claim the RN, the Centralino RN in the future. So let us pray together. Our Almighty Creator, we praise and glorify your name. We humbly submit ourselves on your vital intention to claim the Centralino RN. Help us attain the optimum health at all times with perseverance in leading to our RN goals. Nurture us with your spirit to keep our open mind, to absorb and retain the lecture and skills concepts according to the nurse licensure examination framework. Let us decide to complete every examinations according to your will with prudence and integrity. We appreciate you on our existence to contribute in Centrino 100% through teamwork. As we leap ourselves to you on our journey with the core objectives of the MCU College of Nursing, Amen. So this afternoon, as we start with our discussion and the continuation rather of our discussion, we will have our Slido. Okay, so let's start with our interactive discussion. Last time, we have an overview of the pharmacology, and there are some situations that I have explained in relation to the introduction of pharmacology. So for this afternoon, may I invite everyone to join again in the slido.com. The code is flash on your screen. And our question are, what do you think is the common medication safety issues by which most of the nurses encounter? Even though you have not been immersed into the situation, but what do you think is the common medication issues that nurses encountered that will really, put the lives of our patients in danger? So you may start your response. So non-reporting of adverse reactions. So this is by rank. Let's see. Okay, non-compliance with prescribed medications. Some answered overdosage or underdosage, overload of patient assignments. So number one is still non-reporting of adverse reactions. We have overload of patients. So by rank, non-reporting, non-compliance with prescribed medications. Although if you notice, the the choices are very generic, but later on we'll try to explore, and probably I may ask each one of you of why these common medication administration issues will really compromise safety to our patients. So I think most of your responses are focus on either the non-compliance with prescribed medications or non-reporting of adverse reactions. Okay, just continue with your responses. So we'll see when it comes to the number of responses. So hoping everyone have already have the response. Okay, with the results of your responses, this is by rank. The number one that you have considered is non-compliance with prescribed medications. Number two is non-reporting of adverse reactions. Number three is overdosage or underdosage. Number four, overload of patient assignments. So these are common medication issues, administration issues where nurses have been involved. Okay, so in our perspective, the number one, non-compliance with prescribed medication, is the one that you have considered that will really risk the patient or will put the patient in danger when it comes to the medication. Okay, so I will ask again our students on their answers. May I call on Carmila Lagenlin, what is your response on this safety issues? And you can explore on your answer. Ms. Lagenlin,
Yes po.
from the four choices, what medication safety issues have you answered?
Yung ano po, yung ah, non non-reporting po of adverse reaction.
Adverse reactions. So why do you think yung non-reporting of adverse reactions will really put the patient in danger? If
Kasi
it
po,
will not be reported. Yes, yes. Continue.
apo, kasi po, di ba pag sabi po nating adverse reaction, ito po yung unintended reaction po ng drug. And if hindi po siya na-actionan kagad, di ba baka mas mag-lead pa po siya sa mas anong tawag po nito?
Yung
Mas
serious
malalim po
level.
na, opo,
Yan.
yun po.
Yung serious adverse reactions which we mentioned that it may possibly lead to toxic effect, right?
Opo,
Which
sa
is
dangerous or
life-threatening.
life-threatening. Yes po.
Yes. So one of the typical examples that we mentioned, yes, during the last time of our meeting is relevant to the vaccination. So that's why adverse reactions are very important report that we need to document simply because this will refer on the how the patient experience yung adverse reaction kasi it's not common reaction of the vaccine which supposedly must be cascaded to the proper authority for analysis. And another is reporting of adverse reaction is very significant because this will consider if it is already in the toxic level of the drug reaction, it must need to administer the what we call antidote. And we all know and we have defined that the antidote is the one that really counteract the toxic effect of the drug. Thank you so much, Ms. Laginlin. So I'll ask the other students po or you can you can ayan. So there are students who volunteer to raise their hand. May I ask? Yes, Miss Francine Gonzalez. Can you share your answer and elaborate more?
Yung answer ko po is yung non-compliance with prescribed medications po.
Okay.
Bale, may mga patients po kasi minsan na makukulit, hindi po nila sinusunod yung mga medications na bigay po sa kanya ng doktor. Tapos minsan po yung sa oras, ganun po, hindi po nila sinusunod. So nagkakaroon po ng ibang epekto po sa katawan nila.
Yan. So I think there are two situations that you have addressed. One is if the patient themselves will not comply with the instructions that have been given by the nurse, or the other non-compliance could be is on the part naman ng nurse or ng ating mga healthcare practitioners who did not consider yung standard time or probably yung standards natin ng in particular the medication regimen that must be given to the client. So I think that definitely makes sense na yung term itself kasi na non-compliance, it means that you considered an action which is not in conformance with the standards. Thank you so much, Ms. Gonzalez. So I think there are other two who raised their hand. May I ask Ms. Manyoska, can you share your answer and explore? Oh, and explore on your insight. I'm sorry. So let's go back to the results. Okay, yeah. So let's call Miss Angela. Miss Angela?
Yung answer ko rin po is non-compliance with prescribed medication. Same as the one answered po ni Miss Francine. Additional lang po is mostly po yung patients ay nakakaligtaan yung oras, which is a possible effect nung po dun sa pinag-aralan natin, which dun sa absorption in pharmacokinetics, the half life. Half, tama mo ba? Nakalimutan.
Yeah, correct. You're in the right track. Continue.
So, if hindi po agad nasundan, kasi po 'di ba half-life, yun po yung peak kung saan, isa pang peak kung saan dapat doon na ulit mag-take ng medication para masundan po yung level of the absorption ng medicine all throughout from the systemic circulation. Ganun po.
Yeah. What I like, what I really admire with your answer is merely you already incorporated what you have learned when it comes to pharmacokinetics. Your example is as an example by which it will really refer to the non-compliance because one of your answer, rather your answer focus if the drug is not properly administered on the right time, which basically you have reiterated the value of the half-life because if we will not value the half-life, it will not cause the 100% effectivity of the drug or effectiveness of the drug because if it is not on the proper time that it will be administered, it may not reach its desired effect. Very good. Thank you so much. I really admired. You have incorporated what you have learned last time. So thank you. How about for the rest? I may call on to those who raise the hand. Probably let's have Jerome. Jerome? Mr.
Yes po.
Larin. Yes. What
Di
is
ba
your
po
answer on
yung
this?
sagot ko yung number 4 po, yung
Yeah, it's
overload of
okay. It's
patient
okay.
assignments po.
Yeah. Sige.
Kasi minsan po kasi meron mga biglaang senaryo or emergency na mararamdaman yung pasyente kahit wala po siya sa ER. So if sobrang dami po yung pasyente and lalo po kapag kulang yung mga nurse sa specific na hospital, may chance po na mapunta sa worst case scenario yung patient po.
Yeah. So with your response, what you're saying is that of yung overload of patient assignment is for example, if there will be if there are situations in the area such as emergency room na understaffing and the number of staff is attending to the number of patients which is not in conformance with the supposed ratio of one nurse is to the number of patients. So there could be a possibility that a nurse who attending to the patients may not evenly hindi magiging even yung attention when it comes to the administration of drugs kasi the situation goes that in the emergency room it will really need a lot of time to focus on one patient because situations that these are life-threatening conditions. With your analysis, you are very correct. Okay? So that's why dito there's no wrong answer in the choices kasi it will depend on what insight and explanations that you may have and share kasi which is very true. As di ba nga I even mentioned I always receive reports from the Philippine Nurses Association as the national president. I'm always receiving situations that nurses are overload with the nurse-patient ratio, which is supposedly for the nurse, ang standard ratio that she can tolerate to attend is 1:10. But if the situation goes just like in emergency room, higher expectation will be considered for a nurse who assigned in the emergency room kasi yung skills niya will need to attend to a specialized case. So in this situation, yung expectations then is that of for nurses who will be assigned in the emergency room, she must have the competencies to attend to all these patients that will not compromise the health condition. So, yun din yung situation Mr. Jerome na kaya if you will enter into the profession, probably if you will be assigned in the emergency room, probably you must suggest that you must start first in the ward. Kasi para at least you may know how to do bedside care and attend to situations na emergency situations that may need moderate attention or yung levels of care is mild yung level of care na i-render dun sa type. So we have different types of patients that you may encounter in the ward. So in that sense you can manage through your experience how you will manage safe medication administration. Eh syempre if you will be assigned in the emergency room, higher level of expectation, expected higher level of anxiety kasi emergency situation you need to prepare all the drugs and there are some drugs and medication that can facilitate administration for example, 5 drugs that must be prepared for 1 patient only. How about if you will manage it by 10? So that's why we need to have this in mind, that as nurses, we really need to be focused so that to prevent this medication safety issues. So your answer, Mr. Larin, is very much appreciated and you are correct. Okay, next, how about the
Thank
other
you po.
sharing? Thank you, Mr. Jerome. So sooner or later, if you will become, Mr. Jerome, if you will become a nursing leader someday, think of a possible solution na a risk pala for medication safety is a problem kung overload sa patient assignment ang nurse. So let's think how we can contribute to the solution. So probably soon, if you will be engaged into your course of nursing research, this could find a very interesting topic for us to lead into a recommendation. Okay. So next, how about let us call on Charmy Landayan. Miss Charmy before, and next is Miss Legaspi. Yes, Miss Charmy.
Sorry po kung medyo maingay po. Yung sagot
Sure,
ko po,
it's okay lang naman.
yung sagot ko po is yung non-compliance with prescribed medications din po. Additional lang po sa sinabi nila kasi meron din
Sure.
pong mga patients na di nakakapag-comply sa medications nila kasi po kino-consider din po nila yung gastos. Meron pong mga patients na hindi
that's a
po
good
afford.
observation. Yeah, that's a good observation. Do you still have more to share?
Yun lang po.
Good. That's a very good a very good observation. Yung non-compliance ng patients natin ay meron din yang may economic factors din. Socio-economic factors dun sa status ng pasyente. To the extent that in the United States, why they do not have worries that all of these needs will be attended? Kasi all of them are insured. So covered lahat yan ng kanilang insurance. Unlike here in the Philippines, ang coverage kasi ng ating insurance are very limited. So that's why even if you will be asked to have your take-home medication after hospitalization, dun sa certain limit, kung nag-reach ka na dun sa pinaka-limit ng coverage ng insurance, then the patient will cover na the expenses for the drugs. So if on a financial perspective, if the patient can't afford to buy the take-home medication, so much the patient would prepare na lang to parang withhold na muna to have the medication because of financial constraints, because of the priority for the families. That is very true. Here in the Philippines, that is the reality. But in the other countries, because their insurance has a wide coverage, that's the advantage. So next, I think I called Miss Legaspi. Yes, Karil?
Yes po. Ang sinagot ko po din is yung overdosage or underdosage po.
Yeah, good.
For me po kasi parang sa bilang nurse po, kailangan po nating alamin kung paano po yung correct computation ng dosages po para ma-administer po natin ng mabuti yung mga gamot. And sa way po kasi ng pagkakaroon po ng maling dosage, pwede po natin malagay yung pasyente natin sa mga toxic effects, side effects, na pwede pong mapahamak yung mismong health po nila or magkaroon po ng further issues sa pinaka-health po nila. Yun po.
Thank you, Karil. You're correct. Kasi from the term itself, over, and yung term na under. So yung overdosage, it exceeds to the supposedly amount and volume of the drug. What will make us alarmed if it is over? It means exceeding to the supposedly expected dosage. This may cause the possibility of risking the patient to harm, because any that is exceeding to the supposedly amount or volume of drugs may cause the possibility of what? Forceful workload with our liver and kidney. So pwedeng mag-risk yung damage sa kidneys natin at saka sa liver. Second, if the liver and the kidneys can't manage the toxic, or rather the excretion of this chemical compositions, then this will lead to a possible toxic effect. And any toxic effect may lead to the possibility of danger to tissue damage, and soon organ damage, and probably may lead to multiple organ dysfunction and may lead to death. Kung underdosage naman, sabi, these are some these are some what do you call this? Yung mga issues na myth, 'di ba meron tayong myth at saka facts. Kino-consider din nila daw na mas mabuti ng underdose kaysa daw overdose. Remember class, overdose will risk the patient. Underdosage also will risk the patient. To what extent? For example, um, you lessen the volume of drug because you have 2 patients but you only have 5 ml. So for example, 5 ml of paracetamol is supposedly the dose for that pediatric client. You are managing 2 clients with fever, but you have decided na okay, this medication must be given also to the other patients. So what you did, the 5 ml divided into 2.5, 2.5. So those are under dosage. But the point is, di ba pag tinawag nating pharmacotherapeutics, the right dose itself may reach the pharmacotherapeutics if we have the right dosage that we will give to the patient. So if it is under dosage, so we are not aiming for the desired effect of the drug. It could be useless that we are giving the drug because it did not reach to the proper or the correct dose that the patient supposedly received. So thank you so much for that explanation, Ms. Legaspi. Really admire. Next, how about Ms. Manalo, Alianca?
Yung sagot ko po is non-reporting of adverse reactions, and yung reason ko po for this answer is dahil ang primary finger po na mapopoint po kapag may nararamdamang discomfort yung patient is sa nagbigay ng medicine, which is us nurses. Kaya dahil po hindi nagre-report is baka po ma-incident report po yung nurse at baka mawalan po ng license. So baka takot lang po yung nurse na mawalan ng lisensya dahil sa potential misleading information na ipe-present ng client. Kasi kapag sinabi pong adverse effect po, di ba, harmful unintended reaction, so baka ma-interpret po ng nurse na, hala, baka ako yung may kasalanan kung bakit ito yung nararamdaman ng patient, or hala, baka baka ma-in trouble po ako. So yun po yung sagot ko.
That's a correct observation. That's a very good observation because yesterday when I discussed medication safety to the Department of Health, so I was invited to the Department of Health yesterday in Region 2, Isabela. Okay, that's in the South Isabela Medical Center. One of their concern is they are having hesitancies to report adverse reaction because of pointing that there's an accountability by the nurse that they are the ones that cause the adverse reaction. So who will be at loss if the adverse reaction will not be reported? Is it the nurse or the patient? Definitely the patient is the one who will suffer from the some situations that will not be reported to authority. It makes sense because we are nurses who are serving our patients with full conscience and we are advocating for their welfare. So much as we really need to consider the reporting, it is basically the right decision because we need to have immediate interventions. Kasi the adverse reaction itself is probably there are many factors that will consider if the patient experiences adverse reactions. One of the example is basically there are some situations that when the immune system of the client is really affected by a certain primary diagnosis of disease, this will also cause reaction of drugs that is untoward and unexpected. So if the nurse documented all of this observation, then the nurse will have the high confidence that she is protected. Then at the same time, she is advocating for the patient's safety. So don't be hesitant to report. If, for example, you will be asked to make an incident report. Class, an incident report is not a document that will really put the nurse into trouble. It is on how the nurse will explain the situation, on how it happened, on how you will protect yourselves, and on how you put into perspective the right decision that you have done to the client. So, yun. So, ang concern natin with this medication safety issues, if the client will not, if the proper authority, such as the healthcare team, including the doctors, the clinical pharmacists, will not be informed of this information, who will suffer? Definitely the patients. The patients whom did not reported the adverse reactions may have the possible complications. And if these complications are developed, it will be very hard na to manage it because it's already what? It already existed to the patient's condition. And this is a concern that will really need to be prevented supposedly if it was reported. So I really admire the sharing of your responses. So as what I have mentioned, there are no wrong answers here, but on the matter that we have explored, what is in your mind are really helpful for all of us to share these experiences. So let us now proceed with the next discussion. When it comes to the drug movement, we have mentioned that the first phase is all about absorption. The degree and rate of drug absorption depend on the following. So let's go back to your learning sa biochemistry, sa chemistry, sa cellular functions in anatomy. We have the so-called diffusion. Okay. The drug will be transported accordingly as what I have told you through the blood via plasma. So how this drug are being transferred, just like kung for example, if we call the term, or we consider the term diffusion, the diffusion is merely defined that this is a transport or a transfer from higher concentration to lower concentration. So meaning, just a typical example of diffusion and passive diffusion and carrier-mediated diffusion, if the patient have taken an oral drug, then it will pass through the stomach. In the stomach, definitely the hydrochloric acid will break the chemical composition of the drug. But once the drug entered the stomach, it is still high concentrated. Okay? Highly concentrated yon. So once it will cause the breakdown, it will cause the breakdown of the drug, it's time for the absorption. Kaya that's why yung sinabi ko sa inyo, from the zero absorption, papasok yan doon sa circulation. Pag pumasok na yan doon sa circulation, then that's the time that once it will reach the peak concentration level, that's the time that it reach already the plasma. So yung transport ng drug from higher concentration to lesser concentration, that's why when we presented the line graph, di ba, once it reached the peak concentration level or the Cmax and the Tmax, yung maximum concentration and maximum time, yung graph natin, it goes down kasi that's the time that metabolism and excretion happens because the liver and the kidneys are removing. So ibig sabihin, kung bumababa na yon, yung concept natin ng half-life, then dapat the next drug to be administered on time must be followed, must be complied. Kasi pag bumababa na yung percentage of the drug at nag-half-life na siya, dapat it could meet again the other 50% by those drug that will be administered on the indicated schedule or time. So what is the difference, or what are the difference between diffusion, passive diffusion, and carrier-mediated diffusion? In a simple term, by the diffusion itself, so yung transport of the drug, of the diffusion, is from the higher concentration of the drug to the lower concentration. Yung passive diffusion, from the term itself passive, it's a slow mechanism of transport from higher concentration to lower concentration, because there are some drugs that may need the slow absorption simply because to have a longer effect of the drug. So moreover, these are very common with the pain medications. Pag carrier-mediated diffusion naman, the carrier-mediated diffusion is related on the extent that the diffusion of the drug must be fast so that it will be absorbed directly to the bloodstream and the plasma. Kaya pag mga carrier-mediated diffusion, these are the absorption of drug that are already directed to the plasma, such as the intravenous. Yung passive diffusion, usually yan pag oral medication because it will pass through many phases. Katulad nung video that we have presented before, wherein we have considered if it is from the The oral medication, it will pass through the GUT, it will have the first pass effect of the liver, then afterwards, dun pa lang magre-reach sa circulation, which is the venous, and dun pa lang siya magpo-process papunta ng heart. Unlike for the carrier-mediated diffusion, if it is the intravenous, so sa venous na siya, direction na siya papunta ng heart. So it will not pass through anymore dun sa first pass effect of the liver and with the GUT. So yung pace itself, mas mabilis niya ma-reach yung peak concentration level. Now, the other principle that we're considering naman is related to the active transport. So yung active transport naman po is related on situations wherein if the drug is given po, as what I have mentioned, through the intravenous route, this will cause active transport because it already reached the plasma. So yun naman po yung perspective wherein yung situations in emergency situation, this will cause the possibility na ang choice talaga natin, di possibility but actually the choice. Ang choice po natin is to manage the drug administration via intravenous simply because of yung perspective natin that it must reach the target organ, okay? The target organ so that it will prevent yung damage or it will not aggravate yung condition. So pag sinabi naman natin ng pinocytosis, yung pinocytosis usually yung absorption na yan once the drug entered the cell. 'Di ba yun yung sinabi natin before? Pag pumasok na yan sa cell, madidistribute na yun sa compartment ng cell. Ang cell natin, meron yan extracellular at saka intracellular. So yung pinocytosis is the ingestion of liquid into cell. Okay. So yung liquid na yon that we're talking about, ibig sabihin that could be in a form of the plasma that carries the what we call drug. So once it enters the cell, that is the active transport. The faster yung effect of drug because it is already entering the cell. So yan yung mga tinatawag nating mga active transport. So if you have any question as we proceed with our discussion, the chat box are open for question. You can unmute yourselves for questions or you may raise your hand freely. What do you mean? Both hands? Pag both hands, iba yung dating. Okay, you can raise your hand through the ating what do you call this menu here, or unmute yourselves if you have questions. So far, I'm not hearing any questions. Counting once, twice, thrice. So meaning no questions. Can I see thumbs up if my explanation is clear? So that it will be my assessment if my explanation is sufficient and I will make this simpler. Okay? I really admire your response. The thumbs up meaning it's clear. I will now proceed. Now, this video presentation that I will be showing to you is related on how the drug is now being distributed. From the part that I have discussed about the absorption, this will continue on the perspective how the drugs are being distributed to the different compartments of the cells. Let's see.
Hi, in this tutorial I'm going to talk about the distribution of drugs within body compartments. In the previous tutorial I said that this video would be on the metabolism of drugs, but I've decided that it's probably best to talk about the distribution of drugs before we move on to metabolism. For the purposes of distribution, we can consider that the body is made up of 4 major compartments, which are really collections of fluid, and numerous minor compartments. These major compartments are the blood, or strictly speaking, the plasma, fat, extracellular fluid, and intracellular fluid. Then there are numerous other minor compartments. These include the cerebrospinal fluid, the peritoneum, synovial fluid in joints, and the fetus in pregnancy. There are numerous others, but for the purposes of this tutorial, We'll consider these as one single compartment. So if a drug is placed into one of the compartments, we can see how it might move and distribute into other compartments. Often drugs are placed into the blood. These are drugs which are given intravenously.
Okay, before we continue with the video, the compartments that I have mentioned before that we are talking about, kasi di ba in the absorption, when the drug had been absorbed through the different routes, so di ba it will always end up dun sa absorption natin papunta ng arterial circulating blood or sa arterial system. Di ba yun yung the one that we have mentioned before in the video presentation, that when the heart with the aorta and proceeds to the arterial, so that is oxygenated blood. So the compartment that we're talking about is that of the blood, which I have mentioned. The plasma is the one that carries the chemical composition of the drugs. And the next part, as we'll proceed to the distribution, will already involve the different compartments. And the compartments that we mentioned are the following. Compartments that will consider with fluids. Yan. Ano-ano ba yung mga areas of the body that has fluid? So obviously, the blood vessel has fluid, and that composed of the blood, and the plasma is the one that is significant composition that carries the drug. So in the cell, we have mentioned that there are two compartments. So the two compartments that we mentioned is the intracellular and the extracellular compartment. So, di ba na-mention ko sa inyo before that sa mga cellular compartments, it is composed of electrolytes. Ano-ano tong mga electrolytes na to? Electrolytes could be positive and could be negative. So let's start. So obviously, when the drug enters the cell, it will enter first and primarily with extracellular. What do we mean by extracellular? Outside. Okay, outside. May core tayo na intracellular. Sa extracellular fluid, take this into record and take note of this, that the highest, it will compose of positive electrolytes and negative electrolytes. Ang tawag nga natin, di ba, mga, if you can recall in your chemistry, cation and anions. Okay? So yung positively charged electrolyte, ang highest po natin sa extracellular is sodium. Okay? The highest negatively charged electrolyte sa extracellular fluid is the what we call chloride. So again, sodium, the sodium, sodium. The sodium is the highest positively charged electrolyte in the extracellular, and the highest negatively charged electrolyte in the extracellular fluid is chloride. When we talk about intracellular, the highest positively charged electrolyte is potassium, and the highest negatively charged electrolyte in the intracellular is phosphate. So if these electrolytes are charged with positive and negative, this will eventually consider the electrical impulse or activity of cell. Kasi may positive tayo at saka may negative. So pag kinumbine mo yung positive and negative, do we have reaction in chemistry? The answer is yes. So now, this will really aid yung electrolytes when it comes to transport or distribution of drug. Because if we do not have the positively charged electrolyte and negatively charged electrolyte, there will be no impulse, there will be no activity to facilitate the transport of the drug. Kaya that's why it could be transported via these compartments, intracellular and extracellular. Remember, if you will encounter an IV fluid or an intravenous fluid, or in colloquial term, suero, the suero that is being used, the intravenous fluid that is being used to every patient, if you will check it, it will always have composition of sodium and chloride. Why? Because usually, if there are problems when it comes to the level of electrolytes, most that are usually affected are the extracellular. So that's why we take into consideration po yung extracellular that has sodium and chloride. Please check. If you will search, please do this as an assignment. Search it or use the search engines to search about intravenous fluid composition. Usually, it is composed of sodium and chloride. So it's just the same way that this intravenous fluid, these are also carried by the plasma. So it will pass through the extracellular. So just the same as for the intracellular, it will cause a fast action pag pumasok na yan in the intracellular kasi mas higher ang electrical activity in the intracellular. So another compartment that we talk about are the fats. Okay. Ang fats po kasi, ito po ay compartment that will consider as a reserve. Yan. Yung reserve ito that will aid also in metabolism. So that's why yung compartment ng fats will also aid in that distribution of the drug. So it will ano kasi yan it will convert also into fatty acids yung mga kinakain natin. It will be stored by the fats reserve of the body. So this serve also as an energy, as an alternative to carbohydrates as an food intake. So yung normal or yung natural fat reserve natin, nakakatulong yan sa metabolic activity. But if it is in excess, ayun, nai-slow down yung metabolic activity. So what we're talking about with the fat compartment is that of this may aid in particular for the metabolic activity and distribution of the drug. So ano pa yung mga areas or parts of the body that has fluid? So sabi natin cerebrospinal fluid. The cerebrospinal fluid, since fluid siya, pwede siyang compartment na mag-carry ng drug that will consider the target for the cerebral function, which is the brain and the spinal cord. If we talk about peritoneum, we have the what we call peritoneal cavity, wherein there is the what we call peritoneal fluid. Once this fluid are present, it will aid in the distribution of the drug. Okay, so the peritoneum is the one that covers protection of our abdominal organ. So this may aid also the transport of the drug. Another synovial. So sa synovial, these are the fluids that are present in the joints. So if ever there are some drugs such as, for example, sa mga joints, if there are arthritis, then the synovial fluid will aid to distribute the drug, the pain medication to take effect on the inflammatory condition of the joints. Sa fetus, okay, yung tinatawag nating amniotic fluid. I know you're familiar with this already in your OB. The amniotic fluid is very important to transport the nutrients and even the waste product. This also aid in the transport also of the drug itself kasi fluid siya. Any fluid that will be present in any organ. Ano pa ba sir yung may mga fluid? Sa heart, do we have a fluid in the heart? Yes, kasi meron ng pericardial fluid. Those fluid will aid also in the distribution of the drug. So almost lungs ba? Ang lungs ba merong ang lungs ba meron tayong fluid? Yes. We have the what we call pleural cavity, and that pleural fluid can also aid in the distribution of the drug. So in those fluids that are present in those organs, this aside from the circulation, this may aid also the transport or distribution of the drug. So I hope I made a clear perspective of why these compartments are now being identified for distribution. So let us continue the video presentation.
So when a drug is placed into a compartment, it often associates with binding molecules. These binding molecules are often proteins such as albumin. This process sequesters the drug within the compartment, effectively increasing that compartment's storage capacity. And there is an equilibrium maintained between the bound drug and the unbound drug. The unbound drug within a compartment is then able to move into a new compartment, and thus an equilibrium is maintained between adjacent compartments. When a drug moves into a new compartment, some of that drug is sequestered by binding molecules within that new compartment. This process continues until there is a balance between each compartment and a balance between the amount of free drug versus bound drug within each compartment. The balance between each compartment is determined by a number of factors, and this is best represented using an equilibrium constant. If you've ever done much chemistry, then you'll have definitely seen equilibrium constants before. But if you haven't, then all you need to know.
Sir. Oh, it seems medyo complicated yung explanation. So I will interrupt muna with due courtesy to everyone. To have a clear explanation naman on this matter, di ba, it started when the drug enters the blood. So meaning the drug had been administered intravenously. So that's why it was directed to the blood, and we have the plasma. For each fluid, we have the so-called albumin. So yung albumin at saka yung proteins, okay? Yung albumins and protein, these are the components that really aid para ma-distribute yung drugs component, yung chemical component of the drugs. That's why even as it enters dun yung drug sa blood, the plasma has the level of protein and albumin that will aid and interact with it, yung chemical, to distribute not just only within the plasma, but it will start to distribute already papuntang through and into the different compartments. So if you will notice, it was distributed in the fat compartment, extracellular fluid, intracellular fluid, and other fluids as well. So it means that the drug to have the even distribution, there are many means for this drug to be distributed other than the plasma. So that is what we call distribution. And the equilibrium constant that are mentioned here is that of, if for example, the drug is indicated, the indication is for the heart, such as antihypertensive. So it will consider the distribution through the albumin and protein, it will consider this reaction to its target organ. So si albumin and protein will direct this chemical reaction of the drug even in intracellular or extracellular fluid, but it will lead primarily focus sa pericardial fluid because it aids definitely yung efficient transport sa heart. So yun yung role ni albumin at saka ni protein. So sir, will there be a problem if we will have a concern with the level of albumin and the level of protein? Yes. If there will be a decrease in level of albumin and the decreased level of protein, it will not aid in the proper pacing of distribution of the drug. If the drug naman, if rather the albumin level and the protein is high, it will cause naman the premature breakdown. It will not be continuously distributed. So that's the point of why we are inserting here the point of having albumin and why do we have the protein concept in the distribution. Okay, let us continue. So again, if you have questions, I'm taking it slowly so that everyone can manage to follow the concept of distribution. So you may interrupt so that before we proceed to the succeeding part of the video. Let us continue.
Is that they are a number which shows whether the balance is in the forward direction or in the back direction. I'm not going to discuss equilibrium constants further here, but I am going to talk about the factors that affect whether drugs would prefer to move into one compartment versus another. Thus, I can say that the equilibrium constant is dependent on the permeability of barriers between compartments, the pH within the compartment, the binding capacity within the compartment, and numerous other factors such as the fat solubility of the drug, which is especially important for those moving into the fat compartment.
Okay, so before you will have the information overload, I will just explain this simply. Di ba we have mentioned that there are some drugs that are water soluble and fat soluble, meaning yung solubility of the drug is compatible. Kung water soluble siya, it could be breakdown. Yung fat solubility, it could break down to the specific compartment. So that's why ang mga fat soluble drugs, dun siya pumupunta sa fat compartment para it will facilitate the efficient distribution of the drug. So it was mentioned here that yung equilibrium, yung balance, yung effective distribution may happen and it is always dependent on the three. So minention natin permeability of barriers, pH of compartments, and binding capacity. If we say permeability of the barriers, example, yung permeability is if the tissues are intact, healthy, and can facilitate, yung healthy, ibig sabihin, it receives the sufficient oxygenation. Kung nagre-receive to ng sufficient oxygenation, the tissue are intact, it means the cells in this compartment is capable of doing the action as based from the electrical activity that I have mentioned a while ago. So kung for example, kaya that's why I even told you that do smoking, do alcohol drinking may be considered ba a barrier dun sa permeability ng tissues ng mga compartment? The answer is yes. Do you know that the too much level of alcohol may cause constriction of this compartment? So pag nag-cause siya ng constriction and irritation, then this may alter yung cellular activity para ma-continue niya yung distribution of drug. Another, smoking. The nicotine itself, the level or high level of nicotine itself may cause the irritation to the lining of the compartment. So pag nag-cause siya ng irritation, ibig sabihin pwedeng mag-lead yan ng pamamaga or inflammation of tissues. Pag nag-cause ng inflammation of tissues, ang cells will not act accordingly as expected. So it means it will delay again distribution. Yun yung tinatawag nating permeability. There are factors that will really affect those compartments. Next, pH. pH is referring kung ito po ay acidic or alkalinic. I know in your chemistry, you have the acid and the base, right? So, kung ang compartment mo ay too much acidic, just compare to your situation, just relate to your experiences. Di ba pag too much acid ang nasa stomach natin, how do you feel? Di ba there's pain? There's somehow gastric irritation, there's spasm, there could be chances that you are nauseated or may cause vomiting because too much acid itself. So it means that if the compartments do not have the balance with the acid and base, too much acidic itself, it may cause also a delay in the transport because it may cause a problem with tissues. Ano naman yung binding capacity? Yung binding capacity that we talk about, di ba we have mentioned about the protein and the albumin? So I already explained kung if there is a decrease in the level of albumin in the protein, it may affect the binding. If too much albumin and the protein, it may not also cause effective distribution because hindi siya balance. So that's why there must be a sufficient level lang of the protein and the albumin that could support distribution. Sa pH of compartment, dapat hindi too much acidic, hindi too much alkalinic yung compartment because this may cause premature distribution of the drug. Sa permeability naman, may mga factors that will consider the damage of tissues of these compartments. So dapat ang concern natin dito, so effective distribution is dependent on a healthy permeability, correct pH, and at the same time, sufficient level lang or acceptable level of the albumin and the protein. I hope I have explained it simply and clearly. So again, if you have questions, please just ask the professor and I will give you a simple response. Don't be hesitant, okay? So I know you're here, you're still here pa and listening to me. Diba? Because my energy is still at the top eh. Pag bumababa yung energy ko, it means, okay, we're only 22 in the loop. So probably, are you still active? I know, and it's my confidence. Yan, nag-ano na agad. I know na yung thumbs up itself will really increase my energy. Woo! Okay, next we have, sir, are you okay? Next, let's continue.
Now I'm going to talk about the volume of distribution, which, depending on the level of pharmacology you need to know, may or may not be important. The volume of distribution, denoted VD, is a property of the drug which shows how much drug needs to be within the body to get a certain concentration in the plasma. It is defined as the total amount of drug in the body divided by the concentration of drug in the plasma. I'll give you an example of how it might be used. Say I want to get a plasma concentration.
Okay, so don't be bothered with the formula. Sir, you are now introducing us formula. Okay, we will not go into details of this, but I will just explain simply yung bine-mention about volume of distribution. Yung volume of distribution, total amount of drug in the body. What do you mean by total amount of drug in the body? This is the time that during the distribution, the acceptable, yan. This was, kung oral medication ito, this is the one that already had the first pass effect. So ano yung first pass effect? Again, ito yung i-detoxify ni liver. Every oral medication will have first pass effect kasi it will pass through the liver. It will be metabolized by the liver. So yung amount that is already considered that's been acceptable for distribution, yun yung total amount of the drug. Yung concentration of the drug in the plasma, yun naman yung total concentration wherein we could already identify kung hindi pa siya nagre-reach ng half-life. So, ibig sabihin, kung 100% pa siya na yung concentration of drug in the plasma, okay, 100%. Versus yung total amount of the drug, yung volume of the drug that is being distributed. These are associated with each other kasi kung halimbawa yung concentration of the drug ay 100% pero yung total amount of drug itself is decreased, hindi siya compatible. So useless din yung distribution. On the other hand, pwede namang okay, we have the enough volume of the drug pero yung concentration of the drug naman ay lower down. It's not again useful. It could be useless. So dun pa lang sa perspective na ano yung makaka-affect. Sir, ano ba yung makaka-affect sa concentration of drug? Ayan, di ba minention ko na sa inyo kanina yung mga factors. Pag nag-smoke kayo, it will really affect because this will cause the possibility that will lead to the concern of affecting tissues and cellular activity. Yung alcohol drinking, wow! This higher level of alcohol will cause a problem with the inflammation of tissues. So it will really affect the concentration of the drug. Are we meeting the desired effect in this part of distribution? The answer is no. Yeah, that's why when you take drugs, ano yan? Addiction? No. What I'm referring when you administer drug pala. When you administer drug or even taking drugs, yun naman yun. Whenever you take those medications, sige, those medications and drug, yun din. I cannot live to that perspective. This will eventually consider po on how the body will respond to it. So that's why whenever alcohol and smoking, plus these are factors that will, can you imagine, I always mention then na ang drugs are hepatotoxic and nephrotoxic. These drugs are because of the function of this kidneys and the liver, tapos you will add pa alcohol and the smoke, the cigarette smoke, then this will not be helpful. So ibig sabihin, yung supposedly pag ang liver mo pinasukan mo yan ng alcohol tapos pinasukan mo pa ng drug, can you imagine, magpapacilitate yung priority niya na i-detoxify yung alcohol kasi alam niyang makaka-affect yun sa concentration level ng drug. So can you imagine the stress na nangyayari dun sa forceful workload ng liver. So this will not be helpful. So what is the bottom line here? Have a healthy lifestyle. And consider also these things na to take care of your liver and kidneys. Hindi ako galit ha, pero I am emphasizing it. you must be an advocate of health. Let us continue.
Concentration of morphine is about 5
So I
liters
will
per.
not
Well, by
anymore have
of a
this
milligram for
more
drugs.
kasi I know
In the next video, I
know that the discussion pertaining to the computation of drugs will be taken sa inyong skills laboratory. So that's why the concepts that I will focus in the pharmacology lecture are more on the components and principles of drug. Okay, let us continue. So that's why when we talk about distribution, we mentioned in the absorption, 'di ba? Across 'yan, across tissues. So across the tissues then enters the systemic circulation. It enters into the body, then it enters intake or enters the body, tapos it is across the tissues and systemic circulation. Once it reaches the systemic circulation, that's the time that within the systemic circulation, it enters the tissues. That's why if you notice in our video presentation, it already enters the compartments and that is already referring to the tissues. There are many physiologic factors to consider why distribution could be affected when it comes to the drug distribution. So number one is blood-brain barrier. So remember po yung BBB. Ang blood-brain barrier, so obviously it is in the brain. Ang blood-brain barrier ay barrier. Pag sinabi natin barrier, this is a protection. This will allow, this is a division. Okay. This is a barrier in the brain that will protect toxic effect, that will prevent toxic effect of drugs that will cause damage to tissues and cells of the brain. Kaya if you will notice, di ba po, are you aware of the computed tomography scan or CT scan? It will facilitate yung view of the brain, and it could be evaluated through the CT scan if there will be a dye, DYE, a dye solution that will be injected via the intravenous and will enter the circulation. Once it reach the brain, okay, the brain circulation, it will show in the monitor on what part of the brain specifically identify a damage with the blood vessel, or if there will be bleeding, it will also identify, because if there is a damage or ruptured blood vessel, it will spread into a space or a compartment of the brain. So pag blood-brain barrier, these are endothelial tissues that will protect our brain tissues against the what we call toxic effect or chemical effect of the drug. However, nagkakaroon ng limitations yung distribution if, for example, the patient has increased intracranial pressure. What does it mean? Kung, for example, in a simple term, the patient experienced brain injury brain injury caused by the head accident. So, affecting the head. So, kung ito'y nag-cause ng head trauma, it will cause the possibility that it may lead to inflammation of tissues. Pag nag-inflame yung tissues ng brain, ang possibility niyan mag-e-expand kasi maga. So on that note, pag maga ang brain, ang blood vessels mo nai-stretch din. Kung ma-stretch yan, nagkukos yan ng limitations para mag-circulate yung blood. So ibig sabihin, if there will be a problem with the blood-brain barrier or BBB, hindi niya kayang i-protect yung brain tissues natin simply because yung circulation ay impede or obstructed. So it will cause limited distribution. So these are situations. Another, yung mga highly lipid soluble or fat soluble drugs po ay meron din yang limited distribution kasi hindi yan magpapasa glial cells ng brain. So ibig sabihin, it will delay also distribution. So yun po, ang purpose ng blood-brain barrier is to protect the damage and damage of tissues and cells of the brain. However, Yung blood-brain barrier din, pagka ito ay damaged, this will cause the possibility that this is also the reference. This is also the reference by which it will cause limitations of distribution. Now, another is letter B, cardiac output. Okay. Sa cardiac output po, this will cause a possibility na kung konti yung cardiac output, kasi it is dependent, di ba, dun sa blood volume na sufficient para evenly and effectively ma-distribute. One of the example that I mentioned is anemia. I set this as an example eh. Kung ang anemia, okay, baliktarin natin. Let's have the other one. Pagka, anong opposite ng anemia? Polycythemia. Okay. Pag polycythemia naman, ang problem po diyan is basically the blood is too thick. Okay? Too thick. Highly viscous yung blood. If the blood is highly viscous, do you think it will also cause a delay in the circulation? The answer is yes. Kung if it will delay the circulating blood because of the high viscosity, it will also delay the transport of the plasma with the drug. So that also limit it. So on the other hand, kung anemia naman ang problem natin dito, less volume. So kung less volume of blood, delay din ang transport because the blood volume is not sufficient to distribute it to the cells. So yun naman yung isang explanation on that. On the other hand, this will also consider yung letter C, body composition. Okay, I just want to ask, is there a relationship or association if you are obese? Obesity meaning yung weight mo is beyond the ideal body weight. If you are obese ba, slow ang metabolic activity or high ang metabolic activity? Okay, put it in the chat box. Put it in the chat box, high or low. Okay, high or low ang metabolic activity. Hindi pala. High, I'm sorry. High, tama, yun lang. High or slow. Yan, high or slow ang metabolic. If you are obese, high po ba ang metabolic activity or slow ang metabolic activity? So, we have 3 responses. Okay, continue. We have 8 responses. Pwede po. Okay, continue. Continue po. We have 11 responses. Continue your responses. So, slow, high metabolic. Okay, I'm seeing slow, high metabolic activity. We are referring to to obese individuals wherein the weight is beyond to the ideal body weight. Okay, continue. Okay, some have answers and rationalization. I really appreciate for those who may have answers with rationalization. That's a good sign of really you're connecting with me in the topic. Okay, so continue. Slow. Okay, the others have high. Okay, now let us continue. Most of the problem, there are two perspectives why the patient may have obesity. It's because of the what? Because of the excess adipose tissues. Okay. We all know that adipose tissues are fats. Okay. Ang fats, the fats are not soluble, right? If it's insoluble, it causes a delay in the synthesis. If it will cause a delay in the biologic synthesis, there could be a delay response of the cellular activities. So that's the point. Kaya if you will notice, most of the obese clients can easily experience fatigability because the metabolic activity of the cells cannot support the needed oxygen needed by the person kasi slow nga yung response. So the correct answer is for obese individuals is definitely slow ang metabolic activity because of the perspective that the adipose tissues that may cause the delay, okay, that cause the delay of the metabolic activity is directly associated with the slow electrical activity of the cells, thus affecting also cellular activity. Kung decrease ang cellular activity, then delay din ang response ng body. So delay din ang transport ng drug. So that is what we call body composition. Sir, ano naman yung underweight? Pag underweight po ba, there is a problem then with the distribution of the drug? The answer is definitely correct. To what extent? Because kung ang person naman ay underweight, kulang din naman yung tissues, okay? Kulang naman yung tissues to support naman cellular activity. So kung yung fats naman ay kulang, hindi rin naman siya makakatulong para naman mag-provide ng metabolic activity sa cells. So it's either obesity or underweight. There could be a problem with the distribution of drug. Letter E, degree of vessel constriction and dilation. Okay, what are these factors that may lead to this problem? Degree of vessel constriction. Okay, I always emphasize it, di ba? If there are high level of alcohol in the blood, this will cause constriction. Kaya that's why when a person is talagang overdrunk na with the alcohol, if you notice, this cause dizziness. Okay? The dizziness itself is brought about by the constriction of the blood vessel. At bakit nagkukos ng dizziness? It's because if the blood vessel is constricted, it will not pass through yung blood. And if it will not pass through yung circulating blood, it will delay oxygenation. If it will delay the oxygenation, it will delay also alertness. So you cannot anymore sustain yung level of alertness. Thus, the dizziness itself is already a sign that oxygenation is not already on its acceptable level, decrease na yung level. Kaya that's why if you have already feel that the alcohol is putting you into sleep, please follow your body because that's the time that the cell will need to recharge with oxygenation. Can you imagine the high level of oxygen is the high level rather of alcohol is the one that causes the constriction. Similar with if the person is taking a high level of alcohol and at the same time doing the smoking, double effect. That's another factor. Kaya that's why whenever there are some individuals who are doing the smoking and at the same time alcohol drinking, can you imagine why it leads to the dizziness and why it leads to the constriction? Kasi alam nyo po, the liver is the one that will really cause detoxification of alcohol. Kaya di ba usually on the first phase when a person is drinking any type of alcohol, very frequent that the individual is urinating because that's the response of the kidney to remove the excess level of alcohol. But here comes again, continue drinking the alcohol. If there is increased level of alcohol, do you know, nasabi ko nga sa inyo, nagpo-cause din ito ng delay cellular activity. If it will delay the cellular activity and metabolic activity, the liver will also respond slowly and it will cause also delay detoxification of the alcohol level. So ano na ngayon, what will happen now? Kung magdi-decrease yung response ng liver, magdi-decrease din yung response ng kidney. So what will happen? It will not physiologically process yung pag-remove ng excess alcohol. Kaya as you go on with the increased level of alcohol, nagdi-dizziness na, that's the point that your liver and the kidney is not working well na to maintain the alcohol level. Kasi the more sa early phase you will urinate more frequently. Pero pagdating dun sa mga point na you are already having the feeling of high level of alcohol, very rare na kayo na mag-urinate because your kidney is having a hard time to receive impulses for you to remove the excess alcohol because it's already circulating the body, including your brain. Kaya that's the point wherein it is the same as for the drug, na if it will cause the constriction, it will also delay, and since the plasma is the one that carries the drug, it will delay the transport or distribution of the drug. Next, letter F, degree by which drug binds to plasma protein such as albumin. This is the point that I have mentioned. I have mentioned po that the albumin, the plasma protein such as albumin is very important kasi ito yung magkukos ng binding para to effectively distribute the drug to the target organ. So kung sabi ko nga sa inyo, if the alcohol and the smoking itself will affect the plasma protein, then this will cause a problem with the degree of distribution of these drugs. Okay? So the next is we will have the video presentation, but I think you deserve a health break. It's been a 1 hour discussion, sir. Hindi lang 1 hour, it's 1.5. You started 5:30. So we ended up in 1.5 hour. But anyway, as what I have told you, we will end up every time, the schedule that we have, every time that we have synchronous sessions, it's always up to 7:30 because the 7:30 to 8:30 will be considered as asynchronous. So before we proceed with this video presentation, let's have a health break. A health break for 15 minutes. So since it's 6:55, we'll continue our discussion for 7:10. Okay, 7:10. Hydrate yourselves. Your cells may need fluids to have the right metabolic activity because you may not absorb what I am telling if your cells are dehydrated. Stretch your extremities so that to promote also circulation. So again, we will continue after 15 minutes. This could be the health break. Thank you so much.
Thank you po.
Thank you. So again, it's already 7:10. So I hope that you have already attended to your health needs. So we will now have the resumption of our discussion for the next 20 minutes. Okay. Our next discussion or portion of the discussion will now pertain on how after absorption, distribution, how metabolism is happening when it comes to pharmacokinetics. I will now play this audiovisual presentation to support this basic understanding. And these audiovisual presentations are also available in your Central Lino Pit Stop. It is uploaded in the supplemental learning video. So you may just enter the page and you can watch within the Central Lino Pit Stop all of these videos that I am showing to you during our synchronous session. So let's start the video presentation pertaining to metabolism.
Hi, welcome to the fourth handwritten tutorial on pharmacokinetics. In this tutorial, I'm going to talk about drug metabolism. Drug metabolism often takes place in the liver, but metabolism can take place elsewhere, such as in the lungs or the gut. The fact that most drugs get metabolized by the liver is very important for pharmacokinetics, because drugs given orally may be metabolized by the liver before they reach the systemic circulation. This phenomenon is known as first-pass metabolism. Sometimes first-pass metabolism is so dramatic that it necessitates giving a drug intravenously, as giving it orally would lead to significantly less active drug in the systemic circulation. Morphine is an example of this, which is why it is so often given intravenously rather than orally. However, in this tutorial, I'm going to talk more about the biochemistry of drug metabolism, in particular, the actions of cytochrome P450 enzymes, which are often abbreviated CYP. These cytochrome P450 enzymes are abundant in the liver and different types metabolize different drugs. For example, CYP1A2 metabolizes caffeine, whereas CYP2E1 metabolizes alcohol. Cytochrome P450 enzymes metabolize drugs through a variety of processes. These include oxidation, hydrolysis, and hydroxylation.
Okay. When we talk about the metabolism, as mentioned in the audiovisual presentation, this talks about that when the drugs from the distribution have already reached these compartments, the liver will consider the processing of the first pass metabolism. So again, the first pass metabolism is applicable for oral medications. And in the liver, the common enzyme that is in particular, okay, for the metabolism of drugs is the cytochrome P450. That's why there is a separate cytochrome enzymes for alcohol to synthesize the alcohol. There's also a separate cytochrome enzyme that will facilitate the metabolism of fats. Kaya that's why the liver with these cytochrome enzymes have these enzymes that have a particular function when it comes to metabolism. So what is identified for drugs is the cytochrome P450. Now, the point here of having the processes such as oxidation, hydrolysis, and hydroxylation, we will not focus on these processes, but to give you an overview, this is the processes on how the cytochrome 450 is acting towards the metabolic response to drugs, because this is a way of balancing what is now the appropriate level of concentration of the drug that is acceptable to the body, and what are those compositions that are not anymore needed by the body. So to cut this short, this will effectively consider the chemical components. So that's why we will not anymore consider this chemical phases. That's why I passed through this level. So if you will notice, we have here from the oxidation starts with the cytochrome 450 until the drug will process through its change in the chemical component. The change in the chemical component is indeed very important for the cytochrome 450, so that to value yung perspective of what is acceptable and what is still needed by the body. So once this will be metabolized, the liver will now coordinate to the kidney.
First part of the process, phase 1 metabolism. The second part of the process we call phase 2 metabolism. Let's have a look at an example now. This molecule here is aspirin, or more correctly, acetyl salicylic acid. The phase 1 metabolism of aspirin involves a cytochrome P450 hydrolyzing the aspirin molecule, and the resultant product is salicylic acid. This is particularly interesting as salicylic acid is the active drug. In other words, aspirin needs to be metabolized before it has any effect. Because of this, we call aspirin a prodrug, acid group of the metabolism of drugs.
Okay, just to make this simple, one of the example of the drug that are being mentioned here is an aspirin. Any drug that ends in rin, okay, aspirin, heparin, enoxaparin. So this is what I'm telling you when it comes to the generic name. These are drugs which are identified as anticoagulant. So if we are talking about coagulant, this is referring to clotting. Okay, so there are some situations that aspirin, heparin, enoxaparin are given to prevent the clotting of blood, because the clot itself is the one that will cause obstruction to the blood vessels. So in this metabolism, we have mentioned about phase 1 and the phase 2. From the time that the aspirin is being given to the patient, the salicylic acid is one of the composition of the aspirin. So that's why with this salicylic acid sa phase 2, dyan natin binabalance or ginagamit yung cytochrome 450 so that to identify specifically if the level of the salicylic acid is acceptable to the person's metabolic response. So that's why, from this perspective, it will identify those that are not anymore needed by the body, yung excess salicylic acid, papasok na siya doon sa excretion. And that will be the function of the kidney. So to continue with this phase of metabolism, usually, ang metabolism po of the drug ay usually a drug, alteration of a drug from its dosage from form to more water-soluble form. So ibig sabihin, yung water-soluble form, these are the ones that can be compatible when it comes to its breakdown. Pero pag fat-soluble, di ba papasok siya doon sa fat compartment. So usually, ang metabolic activities of that will involve the drug will pass through the liver. Yan yung first pass metabolism. Plasma, if you will notice, ito yung nagkikarry. If you have remembered po, this is the mechanism or the composition of the blood that carries the drug. The kidneys has the factor when it comes to the excretion of the drug, and one of which is pertaining to the intestinal membranes. Yung intestinal membranes are the ones that are being considered po on the point na yun po, di ba, yung since the intestine, the GUT is highly vascular, that is the one that will continue yung pagpasok na sa plasma until it will reach the liver. So usually, the one that I'm talking to you now is referring po doon sa oral medication. So the next question is that of, sir, if the drug is being given direct intravenous, okay, ibig sabihin to the blood, it already reached the plasma. So the first pass metabolism may not be anymore unexpected part of the intravenous drug. So these are the first pass metabolism are always applicable for the oral medication. However, the next question is that of, sir, so if it is given by the oral, how it will balance pa yung drug itself. So yung drug itself per se na intravenous, yung intravenous preparation already prepared. Okay, it's already prepared to prevent damage to liver and kidney. So yung oral kasi, that is the one that must be passed through the cytochrome P450 to facilitate metabolism. So usually, ang metabolism po will be affected by genetics. What do you mean by genetics? If there are genetically inherited diseases, ito po yung lalo na sa mga blood, okay, yung mga blood, thalassemia, the thalassemia is an inherited po, genetically acquired po ito na sakit that is merely usually nagko-cause ito ng bleeding. So this may cause problem with metabolism, and usually the blood coagulation and clotting is usually a function by the liver. So somehow it will really affect the patient's age and physical condition. So metabolism. So sabi ko nga sa inyo, yung slow metabolic activity are identified with the elders, and yung children may have an active metabolic activity. Kaya if you will notice, why most of the patients do not have hypertension sa children. Kasi nga, yung metabolic activity to balance when it comes to regulation of blood pressure are active compared to elders na slow na yung metabolic response kaya hindi na nababalance yung function ng regulation of blood pressure. It is the same also with the drugs that we're talking about. That's why most of the adverse reactions, high risk po ang ating mga elders. The drug itself, so as what I have mentioned, yung solubility of the drug, if it is fat soluble, mas matagal yung metabolism ng drug. So what is the first pass effect? As what I have mentioned, usually the first pass effect or the metabolism is applicable for orally administered drug. It will always pass through the liver before it proceeds to the distribution sa systemic circulation. Usually, ang mga first pass effect, pag matataas po yung dosage ng mga drugs, ito po yung mga hepatotoxic drug. Usually, yung mga drugs po that will really affect the liver, be careful po in taking paracetamol. Be careful in taking high doses of paracetamol because it is hepatotoxic. Another, be careful also in taking high doses oral of antibiotics kasi this will cause the possibility of damage naman with kidneys. So that's why we really need to take this consideration na we must take care of our kidneys and the liver kasi they will really work anything that goes into the GUT. This will cause the first pass effect if this is referring to drugs. So I think before this could be the last video that is referring to the excretion. So that will complete all of the topics that we will discuss for this week. So this is the last audiovisual presentation, which is also uploaded in our Centralino Pit Stop. Let us continue for a while.
Hi, this tutorial is the fifth in the Pharmacokinetics series. In this video, we'll be discussing excretion of drugs. Excretion is defined as the irreversible removal of drugs from the body. There are two main ways in which the body excretes drugs. One is via the hepatobiliary system. This is when the liver excretes a drug or a drug metabolite into the bile. which in turn gets excreted with the feces. An example of a drug which is primarily excreted by the hepatobiliary system is the antibiotic rifampicin. However, most drugs are primarily excreted by the kidneys. As such, we will focus on this system in this tutorial. In this system of excretion, a drug gets filtered into the nephron of the kidney. If you want more information on the details of this, check out the nephron function tutorial and other kidney tutorials at handwrittentutorials.com. Once the drug is in the nephron, it flows through the nephron into the collecting ducts and ultimately out of the body in the urine.
Okay, if you will observe, this is the common anatomy and physiology of the urinary system involving the kidneys. We all know that the nephron is the basic unit with the kidneys. Just similar for the liver, we have the hepatocytes, which are identified cells of the liver. The nephrons or the nephrocytes are the ones that really function when it comes to the fluid balance. So that's why when the liver is responsible for the metabolism, the kidney is responsible for excretion. So that's why when it enters the tubules of the kidneys, it facilitates on how it will process the removal. But however, if the kidney will be deprived from the circulation, it will not happen its appropriate pacing for the drug. So that's why it will cause a damage with the kidney. Kaya if there are kidney problems, they are very prone to reactions of drug, lalo na pag mga allergic reactions. Ayan, usually because of the kidneys are really affected when it comes to this problem. Kaya usually sila po yung nagma-manifest ng mga hypersensitivity reactions. So let us continue.
So we can define some values here. First of all, there is a certain concentration of the drug in the plasma. We'll denote this CP. Secondly, there will be a certain concentration of drug in the urine. We'll denote this Cu. Finally, there will be a certain
The concentration of the plasma is directly related with the concentration of urine. Kasi nga 'di ba, yung plasma itself that carries the drug chemical, the component of the chemical drugs. Kasi kung halimbawa yung urine is highly acidic, this will follow through a problem with the excretion. Kaya yung acid-base balance must be also take into consideration ng kidneys. So we will not go through with this formula anymore. But one thing that is very important in this perspective
is mostly related to the glomerular filtration rate.
GFR.
Hence, people with kidney disease who have a low glomerular filtration.
Okay. GFR or glomerulofiltrate rate is the process wherein it will consider excretion of the urine. The higher the glomerulofiltrate rate, the higher chances of passing of urine. The lower the glomerulofiltrate rate, the higher chances of retention of urine. Kaya that's why if the kidney is not functioning, take care of your kidneys. If your kidneys are not functioning, then basically it will affect the level of glomerulofiltrate rate. Kaya if, for example, if you will notice pag mga may kidney problem, most of them are experiencing edema or pitting edema. In short, in colloquial, yung pamamanas due to the accumulation of fluid. It means that glomerulofiltrate rate is decreased pag may kidney problem. Tayo, nakakaramdam tayo ng urge sa ating mga urinary bladder because the urine that is being processed by the kidney passes through the bladder before it will be removed out of the body. But if the problem is that of it's with the kidney itself, the process itself of removing the waste products or those that are not needed by the body through the glomerulofiltrate rate, pag ito po ang affected, then it will not process excretion. Let us continue with this.
Pass through the nephron. If they are reabsorbed, then the concentration in the urine will decrease and the clearance of that drug will be reduced. Conversely, if the drug is secreted into the nephron, this will increase the concentration in the urine and also the clearance of that drug. An example of a drug that is actively secreted into the nephron is penicillin. Now let's talk about something slightly different, orders of kinetics. In the system I've drawn above, the higher the concentration in the plasma, the faster the drug will be excreted. This makes sense because...
Okay. So it is related to kung the higher concentration ng plasma, the higher chances also it will be removed out of the body. Kasi the higher concentration, the higher metabolic activity, the fast that it will act upon on the excretion. So that's why we may not anymore consider this concerns, because I know that it's clear up to us of what is the relationship when it comes to the excretion process. So that's why we will end up on this discussion, because when it comes to the excretion, the elimination of drug follows through with the various excretion routes. So kung kidney, urine, liver, bile through the feces. That's why one of the example na nagpa-facilitate nagko-cause ng excretion via the urine, di ba? As what I had mentioned, multivitamins. It cause a change in the color of the urine. So nagko-cause ng bright yellow color. So pag liver, usually yan pag nagtitake kayo ng mga iron-based drug, yung may mga ferrous sulfate, yung mga iron-based drug, yan ang nagpa-facilitate ng metabolism niyan, liver. So pagka ang liver ang nag-facilitate niya ng metabolism, it will appear in the feces as a dark colored stool. So that's one of the observation. Yung lungs naman po, if there are drugs also that are being taken, kaya that's why, di ba, there are some situations na nag-take ka ba, or just simply as alcohol, di ba? Pag alcohol, once the patient exhaled, naaamoy mo yung alcohol. So this is also one way that those alcohol are being relieved by exhalation. So yung pag-exhale po natin is a one way also of removing those toxins out of the body. So ang breast milk po is one of the excretory routes. That's why we are very careful when it comes to the drugs sa mga breastfeeding mothers, because this could pass through the breast milk. So yung mga minor excretions ng route ng drugs are saliva, tears, and sweat. Kaya if you will notice, may mga situations that if the patient is taking any drug o alcohol na lang, kasi di ba nagpa-pass through yan sa sweat, naaamoy nyo sa sweat pa lang yung too much alcohol itself, because it's a one way of excretion routes. Kaya that's why when we talk about these factors to determine the proper dosing, so I think this will be the topic. This will be the next topic or the succeeding topic that we will discuss next week, and I'll stop my sharing. Okay, class, do you have any question with our discussion for today? So I'll just stop the